depression. Depression is not just sadness. It feels like waking up with a heavy weight pressing on your body and mind. A student may stop studying, an employee may lose focus at work, and a parent may feel too drained to care for their children. Even food loses its taste, and hobbies that once brought joy now feel meaningless. Sleep may turn into endless hours in bed, or restless nights of staring at the ceiling. Medically, depression is linked to changes in brain chemistry and structure. Low serotonin and dopamine reduce motivation, while norepinephrine drops, draining energy. Brain scans show the hippocampus, which manages memory, can shrink. The prefrontal cortex, which controls decisions, becomes less active, and the amygdala, which processes fear and emotions, and becomes hyperactive. This combination traps people in negative thoughts and feelings. Depression damages relationships, lowers performance at school or work, and harms the body with fatigue, headaches, and appetite changes. But it is treatable. Cognitive behavioral therapy teaches people to fight negative thinking patterns. Antidepressants restore chemical balance. Exercise and strong social support speed recovery. Depression is not weakness. It is an illness, and with help, millions recover every year. Anxiety disorder. Anxiety disorders feel like your brain is stuck in survival mode even when there is no real danger. A person may feel their heart pounding, their chest tight, and their breath short. Panic attacks can be so strong that people believe they are dying. Medically, anxiety comes from an overactive amygdala, which constantly signals fear. The prefrontal cortex, which should calm it down, becomes less active. Low levels of GABA, the calming neurotransmitter, make it harder to relax, while high cortisol keeps the body locked in stress. In real life, anxiety stops people from speaking in class, attending job interviews, or leaving the house. Relationships can suffer because constant worry becomes exhausting. Treatment includes therapy, mindfulness, breathing techniques, and medicines that increase serotonin and GABA. With the right support, anxiety can be managed and controlled. Bipolar disorder. Bipolar disorder is living between two extremes. In mania, a person may feel unstoppable, sleep only a few hours, spend money recklessly, and take dangerous risks. In depression, they feel hopeless, drained, and unable to function. Medically, bipolar disorder is linked to unstable brain chemistry. Dopamine and serotonin spike too high in mania and drop too low in depression. The prefrontal cortex, which manages judgment, struggles to control impulses, while the amygdala overreacts to emotions. Genetics play a strong role, as bipolar disorder often runs in families. These cycles can ruin careers, relationships, and finances. But with treatment like mood stabilizers, therapy, and consistent routines, people with bipolar disorder can live stable and productive lives. Many creative and successful individuals have managed this illness. Schizophrenia. Schizophrenia is one of the most complex and misunderstood disorders. People may hear voices no one else hears, see things that are not there, or hold strong false beliefs such as being followed or controlled. These symptoms make daily life incredibly hard. Medically, schizophrenia is strongly linked to dopamine dysregulation. Too much dopamine activity in the mesolimbic pathway causes hallucinations and delusions, while too little in the prefrontal cortex leads to poor focus and memory problems. Brain scans often show smaller hippocampus and thalamus, which affect memory and sensory processing. Some research also points to abnormal connections between brain regions that disrupt communication. Genetics play a major role, and complications during birth or early development also increase risk. In real life, schizophrenia affects thinking, speech, and social interaction. Conversations may not make sense, jobs are often lost, and isolation becomes common. But it does not mean multiple personalities, and it does not mean someone is dangerous. Treatment involves antipsychotic medicines that rebalance dopamine, therapy to build coping skills, and strong family and social support. With consistent treatment, many people with schizophrenia live stable and meaningful lives. OCD, Obsessive Compulsive Disorder. OCD feels like being trapped in a cycle of fear and ritual. Unwanted thoughts cause unbearable anxiety, and repetitive actions provide only temporary relief. A person may wash their hands until the skin cracks, or check doors and stoves for hours before leaving the house. Medically, OCD is linked to overactivity in the corticostriato-thalamocortical circuit. The frontal lobe sends false alarms, the basal ganglia and thalamus fail to shut them down, and serotonin imbalance makes the system worse. OCD consumes time, sometimes 4 or 5 hours every day, leaving little energy for work or relationships. Treatment often includes cognitive behavioral therapy and medicines like SSRIs that increase serotonin. With consistent help, many people learn to control their OCD and live normal lives. PTSD, post-traumatic stress disorder. PTSD develops after trauma such as war, accidents, or abuse. People relive the event through flashbacks and nightmares as if it is happening all over again. Loud noises, smells, or even a location can trigger overwhelming panic. Medically, PTSD is linked to an overactive amygdala, which keeps signaling danger. The hippocampus, which separates past from present, shrinks, making memories feel like they are happening now. The prefrontal cortex loses control and cortisol. The stress hormone stays high. PTSD disrupts sleep, trust, and relationships. Veterans may panic at fireworks. Survivors may avoid entire parts of town. Treatment includes exposure therapy, EMDR, and medicines that regulate stress hormones. With time and support, people can reprocess trauma and rebuild their lives. Eating disorders. Eating disorders like anorexia, bulimia, and binge eating are not about food alone. They are about emotions, self-image, and control. A person with anorexia may starve themselves to feel in control, while bulimia involves cycles of binging and purging. Binge eating disorder creates shame and loss of control around food. Medically, eating disorders involve brain circuits in the hypothalamus, which controls hunger, the insula, which processes body image, and reward systems powered by dopamine. Serotonin imbalance also plays a role, and genetics and cultural pressure increase risk. These disorders harm the heart, digestive system, and brain, and are among the deadliest of all mental illnesses. But recovery is possible. Treatment includes medical supervision, nutritional therapy, and counseling. Healing requires treating both the body and the mind together. ADHD. Attention deficit hyperactivity disorder. ADHD is more than distraction. A child may start homework but leave it unfinished, interrupt conversations, or fidget constantly. Adults may forget deadlines or struggle to stay organized. Medically, ADHD is linked to low dopamine and norepinephrine in the prefrontal cortex, which manages attention and planning. The basal ganglia, which helps regulate focus, also develops differently. Genetics strongly influence ADHD, and it often runs in families. ADHD affects school, work, and relationships, but it can also bring creativity, energy, and innovation. With therapy, strategies, and medicines that increase dopamine, ADHD can be managed successfully. Autism spectrum disorder. Autism is not an illness to cure, but a different way of experiencing the world. A child may avoid eye contact, struggle with social cues, or prefer strict routines. Others may display extraordinary strengths like incredible memory, advanced problem solving, or unique creative skills. Autism is a spectrum, meaning it looks very different from person to person. Medically, autism is a link to unusual brain connectivity. The prefrontal cortex, which helps with planning and social understanding, develops differently. The amygdala, which processes emotions, shows unique growth patterns. Some regions of the brain show too many connections while others show too few, creating an uneven balance in processing. Genetics are the strongest factor, with hundreds of genes linked to autism. Environmental influences during early brain development may also play a role. In daily life, autism affects social interaction, school, and work, but it also brings unique abilities. Some people excel in science, art, or technology. With therapy, structured learning, and above all, acceptance, people with autism thrive in their own way. Borderline personality disorder. Borderline personality disorder, or BPD, involves intense emotions, unstable relationships, and a deep fear of abandonment. A person may love someone deeply one moment and feel betrayed the next. This cycle creates chaos in friendships, families, and romantic life. Medically, BPD is linked to an overactive amygdala, which makes emotions overwhelming, and reduced control from the prefrontal cortex. Low serotonin adds to impulsive behavior. Many people with BPD also experience childhood trauma, which changes how the brain handles stress and relationships. BPD can cause self-harm, unstable self-image, and emotional outbursts. But with treatment, especially dialectical behavior therapy, people learn to manage emotions, build stable lives, and recover. And BPD is difficult, but not hopeless. People with BPD feel emotions more intensely than most, which means their pain is real and profound. Validation and empathy play a crucial role in healing. When their experiences are understood rather than dismissed, healing becomes not only possible but sustainable. And if you enjoyed this video, please don't forget to like, share, and subscribe.